Hi everyone. So I wanted to continue the discussion around insulin sensitivity, obesity, and inflammation. So people wonder, what is the big deal with being insulin resistant? Is it not just the body trying to correct something that has gone wrong? So, in the context of a few different things, and I will continue to make short videos to discuss each, but just around insulin sensitivity, it can be a very individual response. So, not everybody becomes insulin resistant in their lifetime. I've seen teenagers that are insulin resistant, and I see other people who are in their 60s or 70s who become insulin resistant. So, very much it's a factor of genetic predisposition, but is very much determined by your environment, meaning what you eat, what your lifestyle choices are, how you sleep, and also how you exercise. So, from a carbohydrate point of view, because we understand that insulin is what is required to move the glucose molecules out of the bloodstream and into the tissue, it is very much a factor of the quantity as well as the quality of carbohydrates, because not all carbohydrates are equal. So when I talk about carbohydrates, these include things like your bread, your breakfast cereals, your rice, your pasta, your potatoes, or other starchy vegetables, as well as baked goods, your cakes, biscuits, things like that. So when we overconsume carbohydrates and the body struggles to maintain healthy blood glucose levels, and the body starts to then excrete or secrete excess insulin, over time this will cause a decrease in insulin sensitivity. The problem with that is that it becomes very inflammatory. So we know that excess insulin will encourage fat storage. So people who develop fat around the belly area and can't seem to shift that, even if they cut their calories, might have to look at insulin sensitivity. So that's the one thing, that it's very inflammatory. Also, when I interpret the cholesterol levels and the different fractions of a cholesterol profile for a client, for example, triglycerides, HDL, LDL, as well as total cholesterol, we can't look at that in isolation unless we consider at the same time things like fasting insulin, also factors like your thyroid and other hormone levels. Because what we notice is that in the presence of insulin resistance, the cholesterol will actually be more harmful. So it's not just a question of bringing the cholesterol down. And that's where I feel the statins always fail, if that is seen as an isolated treatment or solution. So we have to correct our diet in the context of reducing our carbohydrate intake, eliminating harmful oils and fats like sunflower oil, margarine, the very inflammatory fats and oils, and then start to look at how can we eliminate or reduce the inflammatory response in the body. Now, inflammation, depending on how that takes place, can be beneficial. So, for example, when you sprain your ankle, the body creates an inflammatory response in that area, very localized, so that this injury can be healed. So that's an acute inflammation. But imagine that you sprain your ankle every second or every third day, that becomes a chronically inflamed state. And that takes place throughout the body, from the digestive tract to the brain to the joints. And you can understand how that ultimately can lead to all sorts of other diseases. So reducing the insulin resistant, clearing up the diet, cleaning up all kinds of other factors that contribute to inflammation, including insomnia. So I always mention to my clients and my fasting groups that if you're not sleeping well, if you're not getting good quality sleep and long enough sleep every night, you might also become predisposed to insulin resistance, and you might also have higher inflammatory markers compared to someone who is sleeping well. So that ultimately is some of the important things that we have to consider for insulin resistance.